So what we usually do is we start by evaluating. That's good. All right, so we have a look at Linda. What are your concerns?
This line here, this here, consider this, definitely the frown, and a bit of those lines.
So a bit of these lines here, contours going down, this jaw angle and this area over here. Exceptionally well preserved, I might add, but there's always things that can be done in combination. So the key to looking is to show where is the aging process taking place. So you can see straight away that there is this tissue of the face has started to go away, the fat pads, the muscles, the bones, and the focus of these beautiful high cheekbones has dropped to this area over here. And that has caused this tissue to drop. Also, hidden by the hair, the temples have started to hollow, and these tissues have started to come down, and then that forms the fine lines. So, turn around that way. You can see as well, look straight at the audience, just straight at. You can see how it started to get heavier over here. This is all started to drop. So the first key will be to restore volume. And restoring volume will be easy with the fillers to the temple areas, the fillers to the cheek areas and lifting up, doing that to restore the cheek volume, and the apex to the apex instead of to there. That will help this line, that will help to tighten here, then also to fill here, to straighten this line, to fill the corners of the jowl and to do an uplift with purling, uplift there to help to lift up and peg. So the fillers will be vital to do those areas. Also the hollows here start to make you look tired because the skin loses integrity and the bones go away. So some filler on here to fill the hollows. And then these permanent lines that she complained about can also be filled. So there would be a global approach to filler. 8 to 10 vials of filler probably if you want to do all the areas, and you could do in between. Then obviously botulinum toxin, Dysport, to this area here and to the smiley line subtly because you still want natural movement but you just want to reduce it. The botulinum, the Dysport can also be used to raise the eyebrows slightly, for this area the Nefertiti lift, to soften this and allow this muscle to sit here and create the contour of the jawline, which will be nice. And then a little bit around the ooh for these, the smoker's lines, even in non-smoke, or the barcode lines. Yep, we can soften those with this board. Yeah, mostly drinking from a straw. Yeah, okay. And the chin, which starts to pucker, and yeah, you can soften those muscles, and these muscles go. Those muscles here will pull down. You can release them with a bit of Dysport, and that will raise up the corner of the mouth ever so slightly. So that would be the Dysport and the Perlane and the Restylane for remodeling. Then you could, for this area we have that causes fatigue, for these soft lines, the Celfil to biostimulate and create new collagen here. You could also achieve, instead of the fillers, the hyaluronic acid filler, the Perlane, you could put the Sculptra here, here, and here to help tighten and lift slowly over time. You can do both, you can combine them. The Celfil as well for these fine lines, which are very difficult to treat with other injectables. But at the same time as doing the tear trough and the under eye skin, you can do the same Celfil around the mouth. And then to really up the ante and produce collagen, Fraxel for the total face, you would even out the pigment, treat the fine lines, and you combine Celfil Fraxel called Celfrax, so that the healing that you saw from the Fraxel can be increased, because now your platelets are going all over, and your healing will be quicker, plus your remodeling will be quicker as well. Celfil Fraxel, and then your first complaint was this tissue here. If that hasn't done enough for the tightness here, you'd be a perfect candidate for the Marsh. The Marsh full face, 1 or 2 treatments. Over 50 we tend to need 2 because you need more collagen stimulation. So it helps to tighten this here, help the neck, the skin here, help. You can do thermage even to the eyelid skin combined with the cell phone if you want to tighten this and tighten this. So the global approach works much better than just picking one entity. So when people come in and say, I want one thing, rather think globally and do combination therapy, they feed off each other. Even if you choose one area, just the jowls, fill it, thermage it, and cell phone to improve the texture. And you already have a beautiful effect and it'll work synergistically. All right, sign me up. All right, there we go.